My name is Dr. Lloyd Zucker. I'm a neurosurgeon here in Delray Beach, Florida. I am chief at Delray Medical Center. I also practice at Boca Regional. I do focused ultrasound work at the Sperling Medical Group here in Delray Beach. Essential Tremor seems to be a balance in an electrical sense between three parts of the brain: the cerebellum, the thalamus, and the cortex, or the outer portion of the brain. Essential tremor is a disorder of the balance between the three of those. If we were to pick up our arm and move, it looks like a simple motion, but to move that arm out, some muscles have to relax, some muscles have to contract. They need to do that in a very definitive sequence. Anything that breaks that sequence down can alter the smoothness of that motion. We have found through the years with the other methods that have been utilized for this, which were lesions utilizing either the gamma knife or electrodes and deep brain stimulation, that if you disrupt the connection between those areas, you can eliminate the tremor. We can target it utilizing an MRI. We utilize the fact that surrounding it are certain structures that by stimulating them or utilizing the ultrasound energy in a lower amount than would make a lesion, we can actually start to see physiologic effects without actually making a permanent lesion within the brain. In order to do stereotactic surgery, there's a frame that's placed on the head, so the head can be held in position. It's placed under local anesthetic. It's held on by 4 small points around the skull. The patient feels some pressure when it's placed, but really shouldn't feel any pain. The patient's brought into the MRI suite, and the ultrasound unit is not something that's obvious to them except for what looks like a fancy shower cap, because the ultrasound needs to be conducted through water and not air. So they have basically a bonnet that's filled with water. They lay in position depending on how long it takes for us to make the appropriate lesion, and can be as short as 2 hours and as long as 4 to 5. Part of what controls that is the thickness of the patient's skull, and so that's worked into all of the calculations. When we are making the lesion, we are actually walking in and out of the MRI suite. We're testing the patient. We're asking how they're doing. There are some symptoms that a number of patients report, sometimes a feeling of warmth, sometimes some transient dizziness. But what we're really looking for is for them to hold out that extremity and to see that the tremor is gone. They're tested beforehand by drawing lines and drawing spirals, signing their name, and it's very dramatic for them because they're actually laying down while they're doing this, and you can imagine laying down upside down is difficult to begin with, and they go from being totally unable to do these spirals to drawing within the lines. And they literally get up off the table with the extremity no longer shaking. We observe them for an hour to 2 hours afterward, making sure everything looks okay. They either go home, or if they're staying at a hotel overnight, to the hotel. We see them again the next morning, and if everything looks stable, we follow up with them. Depending, again, if they're local, we love to see our patients face to face. It's as gratifying to us as it is to them. If not, we follow up with them by teleconnections where we're Skyping, and they can do many parts of the exam and the discussion by phone, and we continue to follow them out. This is a very small, close-knit team. It allows a very one-on-one, personable approach and attachment to the patient. The people that they meet are the people that they're going to interact with, are the people that they're going to follow up with. If they have a problem and pick up the phone and call, it's the same people that have been involved with them the whole time. And that's a luxury that we have because of our size that hospitals don't have. It doesn't seem like much, but for the patient to have that one group of people that they can interact with, I think it adds security and comfort that unless our patients start complaining to us, we'll continue doing it this way.